Hello, I'm Dr. Omar Danner, and I'd like to welcome you to Healthcare Reimagined. Today, we're going to talk about cancer. Although we think cancer just comes out of nowhere, the truth of the matter is that cancer is a progressive disease, and it's an alteration in the cells starting with the condition we know as metaplasia, which is abnormal changes inside the cell, meta being change. When the DNA becomes abnormal and disfigured with certain characteristics, we call that dysplasia. This is a more advanced form of metaplastic changes, and as this progresses, the cells can lose the ability to die, which we call a lack of apoptosis or programmed cell death, and these cancers can grow into what we call a neoplasm. Neoplasms can be benign growth or they can be malignant. When they're malignant, we call these cancers. And so when you have the malignant transformation, just understand it's a spectrum or a continuation of changes at the cellular and then the DNA level. When these cells lose or move from the local place of origin, then we call this metastatic metastases. When you have metastases, this means that this cancer has advanced and it can affect other parts of your body, and this puts people at increased risk. So when you're undergoing therapy, say surgery, one of the things we may evaluate you for to see if this cancer, say colon cancer, is local or is it spread to the liver. If it's spread outside of that, then we may have to do things like administer chemotherapy and radiation therapy, whether it's breast cancer or colon cancer, before we operate. And this is where your medical team comes in and tries to create the best possible regimen to give you the best chance of a good outcome. What I'm here to tell you is that cancer in and of itself, as well as cancer treatment, actually is an energy-driven process, but also a nutrient requiring process. So just like your body needs nutrients and fuel to run, that cancer consumes these things, and the chemotherapy and radiation also causes your body to utilize these nutrients and causes nutritional depletion. This actually compromises the other cells, the normal tissues in the body, and this is what leads to a lot of the fatigue, the body aches, and the wasting that we see when somebody's undergoing cancer treatment. So what I challenge you to believe and to do is to understand that you should be maintaining your nutritional status, your micronutritional status, as well as you're getting in adequate calories, particularly in the form of protein, to maintain the lean body mass. And if you were to do this and do it consistently while you're undergoing treatment, it will make cancer care for you holistic. And you should be doing these things in concert with your treatment program instead of waiting until after you've blown the engine and your body is deteriorated and now you're trying to recover. An ounce of prevention is still worth a pound of cure, but you should be doing these things simultaneously. And there are supplements such as like Life Pack, Nano, and G3 and high dose vitamin D, which is a complete nutrition supplementation regimen, along with something called Reishi that helps augment your body's immune system, because it should be fighting the disease along with the chemotherapy, the immunotherapy, the radiation, as well as the operation to help you get through this challenging situation. So I just want to encourage you that the other element is faith. And if you mix faith with your desire, that's the formula for hope. So we're with you, we're praying with you, we're rooting for you, but you have to work with your doctor and follow their guidance. But in God's time, you also have to do your part. And we just want to encourage you that there's still hope. So don't throw in the towel. Keep fighting the good fight of faith. This is Dr. Omar Danner with Healthcare Reimagined. I want to thank you for joining us. Have a great day.